Hey everybody, I'm Dr. Nick Circolone. I am so excited to be with you today. Today we're going to finish up on how the neck can cause different kinds of symptoms. Today we're going to be talking about how the neck can cause elbow and wrist pain. Week before we talked about how the neck can cause shoulder pain. Today we're going to talk about the elbow and the wrist. So how does that relate to kind of everyday life? A lot of people get elbow pain and wrist pain and don't understand where they're coming from. We'll start with the wrist. Sometimes we have numbness and tingling because we're typing too much. We're using our hands, such as using a hammer or a screwdriver. It could be anything that would cause excessive movement of the wrist will give us what's known as carpal tunnel, which is pain in these three fingers. So you have your thumb, your index finger, and your middle finger. These are most often due to a median nerve involvement. Where does that median nerve originate? Where all the nerves originate, from the spine, but this one in the cervical spine. So if the cervical spine is implicated in this, we can have the same type of symptoms. What do we do if we have carpal tunnel symptoms? Well, first thing we do is we find out what's causing the problem. How do we do that? And we talked about an earlier show where we would do an EMG. An EMG will test from the origination of the nerve to where it terminates. Now, here's the part that a lot of people miss. Even though we see a carpal tunnel on an EMG, does not necessarily mean that we don't have impingement in the cervical spine. I would say probably 85 to 90% of the people that have an EMG will have some sort of carpal tunnel show up. That's a large majority. What that means is that most people suffer with some sort of carpal tunnel. Does that mean it's severe enough for surgery? No, that just means that we're finding it when we're doing these tests. We can also find epicondylitis, whether it's lateral or medial epicondylitis. Those two areas seem to be misdiagnosed the most, or let go for so long that they require surgery. My job as a chiropractic orthopedist is to make sure that we catch these things before they get to a point where we're going to need surgery. What's the difference in what I do versus other orthopedists? Well, I'm a non-surgical orthopedist, so let's put that in perspective. I'm looking for things that we can fix non-surgically. When you go to the orthopedic surgeon, they're looking to see how they can fix things surgically. Now, does that mean that they're going to do surgery every time you do it? No. You know I am not against surgery. I'm not going to say that doctors do surgery unnecessarily. That's not what I'm saying. What I'm saying is when you go to a surgeon, they're looking for a problem they can fix surgically. When you come to me, I'm looking for a problem that I can fix non-surgically. So let's start with the wrist and the elbow again. And in between is really important because we have these muscles that are in this area that can become overused or a repetitive strain. And we'll have problems with our supinator muscle, our pronator muscle, our brachioradialis muscle. All of these will give us pain in both the wrist and in the elbow. So how do we differentiate them? Well, number one, we do it through examination. We start with the cervical spine, as always. What is the cervical spine doing? Do we have any problems in that cervical spine? What is our age? The age of the patient makes a difference. If we have older patients, we're probably going to see more of a degenerative change that occurs in that cervical spine. With our younger patients, we're probably going to see more of a soft tissue, the disc. As we evaluate this, we then work our way down to the problem, not up from the problem, but down to the problem. So we evaluate the neck. Well, let's say we do what's known as a compression test, where we push down on the cervical spine and it causes the same symptoms. Well, now we're looking at the neck. Let's say we lift up and distract cervical spine and we get relief of symptoms. Now we know, hey, we have something going on in that neck area that we should not be missing. Then what we'll do is we'll do some tests in the elbow, some orthopedic tests. Mills is one of those tests that we use. It's where we're trying to stretch out that muscle to see how much pressure we're going to have in that elbow. Another test we can do some things like Phelan's tests, okay, where we're trying to see if we're reproducing that same amount of pain in the wrist or in the elbow. These are just examples. There's a ton of tests that we can do. So now we find out that we have a positive Phelan's. We have a positive Mills. Does that mean we have an epicondylitis? Does that mean we have a carpal tunnel? We did a compression test in the cervical spine. Does that mean it's a cervical problem? It's all about examination and the history. So let's say those areas are definitely causing some issues. What's the first thing we're going to do? Probably take an x-ray, depending on the mechanism of injury or how long it's been going on or what started it. Sometimes it's not an injury. Somebody could just turn their head the wrong way, sleep the wrong way, and start having these symptoms. That's not what caused the problem. What caused the problem is a degenerative change that's going on in there, or there was already a problem that was just exacerbated by sleeping or by any activity. So what we do then is we'll say, okay, let's start with the cervical spine and do an x-ray of the cervical spine. And what do we find? There's degeneration in the C5 and C6. Okay, we know that that could be potentially a problem. So then we start treating the neck area. We're not neglecting the elbow or the wrist. We're also treating those as well. We can do some manipulative therapy on them. We can use modalities like ultrasound and e-stim on there. We can do myofascial release where we loosen up the muscles. We get the fascia to release. We get the trigger points to release and see if that helps. So what we're doing is we're looking to see if we can make the symptoms better. Now, a lot of times when patients come in to see me, they've already been through the gamut. They've already seen their family doctor. They've already had x-rays. They've already done medications. They've even possibly done PT, but we still have the problem. So that's where we come in and we start from scratch to look at what's going on. We may order an MRI at that time if it's not been done. We may order the EMG if it's not been done. A lot of times when we see the patients, those tests have not been done, and then we just get to order them, find out what's going on, and then deal with the problem. The whole purpose of the show is to make you realize that the neck can cause, as we said before, shoulder pain, it can cause elbow pain, and it can cause wrist and hand pain. The key or the takeaway is how are we going to take care of those problems without doing surgery? The thing that you need to do as a patient is you need to get looked at long before it becomes a problem. I've had patients come into the office where I have numbness and tingling. Never see the patient again. I see them several months later, and what I'll find is, I can't pick up my coffee cup. I can't pick up a jug of milk. Now we're dealing with more problems. The longer you wait to have something evaluated, the more you may need to have more invasive procedures in order to make sure that they get well or get taken care of one way or the other, whether it's surgery, whether it's a long stint of therapy, could be a number of things. One of the things that we like to do, and I'm going to just end with this, one of the things we like to do in the office is called decompression therapy. You've probably heard of decompression therapy for the lumbar spine, works wonders. We also have a machine that does it in the cervical spine, where we're distracting the cervical spine to release tension around the disc, to release tension around the facets, which takes away the symptomatology that the patients have, whether it be in the wrist and hand, whether it be in the elbow, or even in the shoulder. Decompression therapy works so well. I've been doing decompression therapy now for about 25 years. I was the first chiropractor in Chattanooga to actually use decompression therapy. And let me tell you something, over the years, we have seen miracles of patients getting better without surgery. So there are treatments that we can do to make you feel better before you go to surgery. The key is that you get to see us sooner rather than later. You have a great day. Enjoy your week. We love you, and we'll see you soon.